none of that is what we were meant to actually be. And if we think about the who's the goddess of beauty,
Oh yeah.
Aphrodite's?
Yes, I think
Yes.
so.
Yeah. Like if you think about the image, like, you see her statues and stuff, she was voluptuous.
Yes,
She had, and it wasn't
exactly.
because now what I see is like curves like breasts and like booty are okay, but then you got to have like a small waist, like that's
Right.
like, and I'm like, no, 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 no. Like it's all of it. Like,
Everything. Hello, hello, Leslie. I'm Thornton, hypnosis for permanent weight loss. Today we have Dr. Hanisha Patel with us. I'm super excited for you guys to meet her. I'm going to read her introduction first. So, Dr. Hanisha Patel, a naturopathic doctor specializing in women's health, helps women reverse hormonal issues like PCOS, Hashimoto's, hypothyroidism, and infertility. After overcoming her own autoimmune challenges, she founded Mahan. Am I saying that right?
Mahan.
Mahan Health, a virtual practice supporting hundreds of women. To make holistic medicine accessible, she created the Mahan membership program. Dr. Hanisha also hosts the Mahan Health podcast, shares insights through social media with over 12,000 followers, and has been featured in various interviews and publications like the Townsend Letter. Dr. Hanisha, welcome.
Thank you. Oh my gosh, thank you so much for having me.
Oh my God, absolutely. We met a couple months ago now, and immediately I was like, I'm in sync with this gal. I'm excited to bring her to the audience. And, um, you know, something that I really care about for all my listeners is that they're educated on all the different things. And obviously, hypnosis for permanent weight loss. And we work mostly on the mental and the emotional aspects around the obsession with food, body, and weight. And as a nurse by trade, I also acknowledge that there is the physiological, right? And the scientific aspect as well. And, sometimes weight is affected by those actual things going on in people's health too. Um, and of course, wanting them to also be inspired by your story as an entrepreneur and a mom and your victories over the past as well. So super excited for anyone listening to get to hear more about Dr. Hanisha's story and share in the glory that I've been, blessed to be able to be in the presence with. So again, thank you for being here. And I always like to start out, how did you start doing what you're doing? And I think, you had medical background as well, similar to me, working in the kidney transplant and surgical and neuro ICU. So yeah, what did you do? Yeah, tell us about it.
How did I get here? Well, first of all, I just want to appreciate like your kind words. It was genuinely like when we met, it was like an immediate connection. And
Yes.
so I'm so grateful to be here. And yeah, a little bit about my story. So I actually got my degree in pharmaceutical sciences. So when I was in undergrad, so my bachelor's is in pharmaceutical sciences. And while I was studying and learning about the different medications needed for certain conditions, we also learned about the side effects of those medications, and then the medications needed for those side effects, and then the medications needed for those side effects. And it was
Yes.
just like this like vicious cycle of like medications. And
Yes, and they would just prescribe those medications and not even let you know about the side effects. And sometimes the patients would start experiencing that. I saw that happening on my end as a nurse. But then you're right. Then it's just true. Instead of like, wow, if we just looked at the initial one, we could have maybe adjusted something over here. So we're not just on more and more and more.
right, it just continues. Like, and the other, like, yeah, like you said, like if we would have just started with the first symptom or whatever condition that the patient was coming in with and addressed the root of the issue,
Yes.
maybe we could have actually prevented them, right? And so like
Oh,
that wasn't a concept during like during my schooling. And I remember just being like, this doesn't make sense. Like this doesn't make any sense to me. And I was like, this can't be the only way. Like there's got to be a better way. And I knew like I was into health enough to know that nutrition definitely played a part, and hearing
yes.
doctors say that it didn't was also very confusing for me. I was like, that doesn't make sense either. I
Oh
knew
my
nutrition
God.
and exercise like definitely played a part. I didn't know as much about herbs or any of the other stuff that now I'm like magic. And I love, and like the subconscious reprogramming, the hypnosis, like I didn't know about any of that stuff, but I knew nutrition and exercise, those impact your health, period. That's all
Yes,
I
and if
need.
I could just pause you exactly, it's like reaffirming why we're so in sync. But going like to talk about the root cause aspect, like same but different. That's my story that I've been sharing so often lately is how the person who invented Weight Watchers, like she found out she could lose weight after she locked herself in her laundry room and ate a whole box of Little Debbie's cakes or something. And then Weight Watchers was born because it was like, oh, how could you eat this many sweets and still lose weight? I'm like, why aren't we asking why she locked herself in her laundry room to eat Little Debbie's cakes in the first
Wait,
place?
what? Had no idea.
Yes, I
Wow.
know. And that's why I'm so passionate about helping people like actually break free from diet mentality. But it starts way before, like you're saying, it's like the initial symptom. Like before we just add and add and add and control and control and control, like, can we just slow down and start asking more questions about the initiation of symptom?
Right. Where did this come from? What's going
Mm.
on? What traumas did you have?
Yes.
What was your upbringing like? What did you eat? Were you a vaginal delivery baby or C-section? Were you breastfed or formula fed? Like, what kind of toxins are you exposed to? I've had people who like grew up near like chemical plants and they have serious hypothyroidism. And that is something that we're working with. Like it's like, okay, if we don't address these things, we would just be like, here's the pill, which yes, sometimes is necessary, right? Especially with
Yes.
thyroid stuff. It's absolutely necessary sometimes to take the thyroid medication. But if you keep increasing the dose of that medication and the symptoms are not changing, the labs are still looking off, like there's something missing, right? Like
That's
there's something
right.
missing. And so recognizing that like the toxin exposure has impacted her thyroid, like just those
Yes.
kinds of things, like um and yeah, and that was like where like that was the start for me. That was like the very beginning. This was over 10 years ago now. And
Mhm.
I remember everyone thought I was crazy for like questioning it. Everyone
Asking
thought,
those questions.
yeah,
Yes. I
everyone
remember
thought,
being working in the hospital and being like, I cannot make the impact that I know that I can make, like, because it's a business, like hospital medical, it is.
Mhm.
And, they just need to get people in the door and out the door and get them symptom free and whatever. And like, yeah, it's a
Absolutely.
major thing. So, anyway. I
For
was like,
sure.
I need more time and space. And like, I love intimacy. Like, I love actually getting to know
Yeah,
the person on the other end like so well so that I can actually do a good job for them. And I just knew I couldn't do that there. So, yeah, and same thing,
absolutely.
11 years of my,
Yeah.
leaving and
Yeah.
saying I'm going to help people, in the only way that I actually can that's better than what I'm seeing here.
Yeah, actually it was 11 years for me too. Yeah. It's
Nice.
so yeah, like we were like so synchronous during
Hmm.
that time without even knowing each other, which is so crazy and so
It
cool.
is. Hmm.
But yeah, it was like yeah, I genuinely felt like I don't know if I'm crazy, but like this feels crazy to me, And so yeah, that was like where oh, actually, and I wanted to say too, like when you said it was a business, like absolutely it's a business. And one of my professors would talk about that. She was my pharmacology professor, and I really appreciated that she brought this up because that also helped me be like, well, I'm not 100% crazy, right? Like
Yes.
there's something to this that's clearly not for the patient. It's not
Yeah.
for the people.
Right.
It's for profits.
Yes.
And what she told us was, I remember this very clearly because this was like a huge turning point for me. I was like, yes, this is what's wrong with it. And she talked about how for research to be approved, for medication to be approved through research, it used to be like an 11 to 20-year process. And then they shortened it to within 5 years and sometimes even within 1 year just to get things on the market. And without understanding, and she talked about it, she's like, we don't understand the long-term impacts of it. We don't understand what exactly is happening. And they just put it on the market because then they can make more money off of it. And
Yeah.
so she talked about how that was really problematic. And I'm very grateful for her for bringing that to everyone's attention, not just mine, right? Like she was
Yes.
teaching a class of a few hundred people like
That
we're
is huge
probably
for her
going
to say
into
that.
conventional
Yes.
medicine of some sort, whether it's pharmacy or medical school or whatever it is. And so like having that, I feel like was really like I really appreciated that because we do understand now. Like I mean, we see so many drugs that just like go on the market with less than even a year sometimes of research, and we don't know their long-term impacts. And so that's definitely problematic, and it's all a business plan. And then all of a sudden we have these issues and they're like, oh, here's another medication to solve those issues. And it's
Oh,
like, oh my gosh,
I know. And that
we could
such
just get to
value shows the value of education and also like good education, the fact that she went that extra step. Because I do also have, I know that it's innocence for so many providers to just keep prescribing, because that's just what they see. And if they
right.
never had one person say, like, and let's be aware of the fact that this is a business, pharmaceutical is a big business. Yes, it's needed. Like, thank God we have these things to get people relief fast. You know, if I have an emergency or if I feel terrible, I want something fast that's going to help me. And I want to have the education to be able to be aware of
Right.
the impact of staying on that or not looking at the root cause or being aware that doctors aren't always aware. You know, I grew up in a family where doctors were gods and like
Mhm.
whatever they said. And I, you know, when I really, and even when I was taking care of patients, the patients that would kind of want a second opinion, they weren't greeted with warm
Mhm.
whatever to do so. They were kind of judged and criticized for, you know, doing that. But it's like, no, good for you. You need to figure out, you know, and make sure you feel confident about what you're doing before you just say yes to whatever.
It's your life.
Oh
It's your life,
gosh.
your health,
I
right?
know.
Nobody else is living your life other than you. No doctor has any idea what you are experiencing every single day, even if they get to know you. Like, that's what I tell every
Yeah.
single patient that I work with. It's like, I will get to know you so intimately, but at the end of the day, you know you the
That's
best. You know
right.
your body. And my goal
Yes.
for you is that you know your body even better
Of
than
course.
than ever before, right? So that you
Yes.
know your mind, body, and spirit and what you need to support yourself. That's the intention. That's the goal. Is like, how do you support yourself through anything, right?
And what a
That
gift that you're
resilience.
empowering them to have that voice to say, to speak up if something feels off, because people are also intimidated, you know,
Yeah,
and so they just go past it and then they go home feeling bad. But it's like, I want you to also trust yourself that you know
absolutely.
what's the right thing for you. And that's what I
Yeah.
have all my clients do as well, of just like, kind of similar but different. I say to them because recently I've been talking about how like consider that you don't have a food problem or a weight problem, you have an emotional problem and you have an empowerment problem. Like so much of the coaching that I do for my clients is just communication and knowing how to speak up and how to listen to their intuition when it comes to their body signals around eating, but also around when to say something, how to say something. Like we're not taught these things. And then all of a sudden you're just, you know, you just come out of the doctor's office feeling like you just got hit by a bus with all this overwhelming information and nothing to do with it. So it's
Mhm.
like, yeah, there's also the empowerment piece. And I love that you provide that. So then what was your transition like? So from you were doing that, was it your residency? And then did you actually,
So that was my bachelor's.
okay. Yep.
And so that was in undergrad. And then I actually ended up traveling to both Guatemala and India, learned about their traditional medicines.
Cool.
It just like got obsessed. I
Cool.
learned about traditional organic farming and then all of the
Yes.
herbal medicines, shamanic healing, energetic medicine. I learned about like the herbal medicine in Ayurveda, yoga. And I was like, this feels right. Like all of this feels right. And so then that's where when I came back from my travels, I was like, I need to do something with this. I can't go to conventional medical school. I had like already applied and got into some like DO schools because I thought it was more holistic. And to some degree, it is.
Mhm.
But then I discovered naturopathic medicine and I was like, I read like the principles of naturopathic medicine and I was like, they like this just like, I was like, oop. I felt like it was so quick. I like applied, got it, and I was just like, all right, let's go.
Soul's
We're in.
calling. Oh,
It
doesn't
felt,
it feel
yeah,
so
it
good when so
genuinely felt like
aligned?
it. Yeah.
So I studied abroad in Mexico when I was in college, and that completely, so we were on sustainable farms every single weekend, and like all, and I was like, I found my like I know where I belong, like all the different things, and then everything I studied was holistic, like not, you know, for medicine, all for, and obviously then I found hypnosis anyway. So
Yeah.
just still dovetailing all the different things, but I love that you felt that pull. When I found coaching, I say it was like I was lit on fire. Like, are you kidding me? This is exactly what I want to do.
Absolutely.
So I
Oh,
love that
I
we both
love
got
that.
that because I know so many people don't have
Yeah.
that.
And, one of the things we actually started, that we talked about right before we started recording was one of my favorite quotes is, your heart is free, have the courage to follow it.
Oh,
And I remember, like I said, everyone thought I was crazy. My parents didn't support me. They were like, "What are you doing?" Nobody was supporting. My friends were like, Just go to conventional medical school," and a lot of them did. And I was like, I don't know why. And it's really, really amazing now because 11 years later, a lot of my friends who did go to conventional medical school are telling me that I did the right thing and they feel really stuck
Mhm.
and burnt out and
Right.
they're really struggling. They're like, this isn't what I thought it was going to be. And they're like, you actually made the best decision. And I'm like, whoa,
Yeah,
this is
I know.
huge.
I know.
And like it's unfortunate that you're going through that. And this is like why this is my reminder every time I'm feeling off. I'm like, okay, what is my heart saying? Right.
Mhm.
And so getting out of our anxieties, and that's the thing, if we're constantly in the state of like stress, which is why I love what you do, is like if we're in that state of stress, we can't even hear our intuition. We can't hear what our heart has to say,
Yeah.
right? We can't hear it. It's like there's white noise or whatever, there's noise in the way. We can't
Yes.
hear that. And so
Yes.
being able to even just hear that in itself is like powerful. And then following it, that is when you're
Ah,
really stepping into your power. And
and that's when
that's like
everything aligns. So did you
everything.
have a journey for yourself of going through like quieting down the anxiety? Like, was that part of your travels? Was as you were experiencing those things, was it also like what did you deal with prior mentally
So
and emotionally
kind
so
of.
that you could feel the intuition?
Yeah,
Okay.
kind of. But I remember, like, I've always been a little bit of a rebellious child in general. Like, I was always, so in Hindi they say "badtameez," and essentially just means like obnoxious, like disrespectful, like all of that. Because I always kind of did my own thing anyway. And
Okay.
so that was like a part of who I just was.
That's cool. Yeah.
And so I
Mhm.
I feel like whenever it happened, I was like, I don't know, something's telling me I need to do this. Like, I'm just gonna do it. Like, I
Nice.
don't
So
care
you
what.
already had that built-in like boldness, like you didn't
Mhm.
have so many fears, like that was part of who you were, what everyone said you were.
Absolutely. And
That's
it's so
cool.
interesting as like, we get older, sometimes it can go like, and this is why I always come back to this. I'm like, I know like when I did that for myself, like this was the best decision I've ever made is going to naturopathic medical school and
Oh,
becoming a naturopathic doctor and being here today. Like genuinely, whatever happens in my personal life, whatever any things that might be off, I come back to what I do and I genuinely feel so in love with my life and so
hmm.
excited that I get to do this.
I
Like, and
know.
so this is what I always come back to when in my personal life, if ever I'm like, okay, what is my heart saying? And I'm afraid to follow it. I'm like, but remember that time.
Yes, that
Like,
I did
remember that
actually
time.
do this
And so
and
now
look
I
what
trust
happened.
it
I
too, right? So
know.
when you do that and you follow it, you start to trust yourself and that you
Yes.
build that trust in yourself. I'm like, no, I know. Like, and now I'm in
Mm.
this place where I'm like, no, I know.
I
I know what I need. I know what,
know.
and
Yes, you're
that's
describing
what
it
we want.
so well.
Yeah.
Yes, thank you for sharing that. Yeah, and for anyone who's listening, like that's the heal method is what I bring my clients through. And so the first part of the program is really quieting down the mental using hypnosis as well as the emotional. So H for hypnosis, E for the emotional mastery. And it's like once we get a handle on the thoughts and the feelings, now we have the ability to actually feel the body. So
Mhm.
before I was free from constantly thinking about food, body, and weight and had no ability to feel intuition when it came to my health and my eating. Yeah, the thoughts were just too loud. The anxiety was too. So people would teach me intuitive eating, but like it was like I was like, forget this because the mental and the emotional were so strong. And
Yeah.
so, but then you can, once you go through the two parts, then it's about A is for align to your authentic self. So this is like listen to your intuition about all the things.
Mhm.
The other thing, which I'm curious to hear, you're a part of this because everything you're saying is like my entire life and how it's continued to unfold. Um, was I actually had to give myself permission to follow my desires. So I had listened to enough spiritual teachers, Joseph Campbell,
Mhm.
Bashar, all talk about follow your bliss. If you
Mhm.
go on the path of your highest excitement, you can't go wrong. And I feel like in our society, there's so much shame around like doing things that actually like bring out the excitement and bring out the ecstatic feeling. I used to run an ecstatic dance
Oh yeah.
companies, so like the free form,
Yeah, I love that.
dance, whatever. Um, and my whole life has unfolded by following the exec. So part of that was also I had to be so honest with myself that like what I actually wanted was to actually eat these foods that from my health background were bad, wrong, because I was a lifetime dieter that like all these different things. I knew all the signs of how these things in my body were going to like tear it up or like, make it terrible and all this type of stuff. But in order for me to have a healthy relationship with food, I kind of needed to have some exposure therapy of like just actually allowing myself to have these foods and get over the initial fears and anxiety so that I could have
Mm,
like a normal healthy relationship and then naturally go back to the things because I wanted to feel good, not
mm,
because it was the right thing to do on paper.
right.
So just for anyone listening, it's just like, how can you, first of all, if you have too much anxiety or mental thoughts going through your head, to be able to listen to your intuition, whether it's with health related decisions or if it's life related decisions, like if you're not happy in your job, like Dr. Hanisha is saying, right? Then it's like, okay, like there are steps to follow. Um, and then, yeah, giving yourself permission to actually go after what your heart is asking for you to do. And you're right, through repetition of those things, this is where you start to build in that self trust and start to like co create with the universe
Hmm.
and find whatever it is that you were meant to do while you're here, which is to
Yeah,
be, how could there be anything more exciting than that? And
absolutely. I
everybody's
love
is
that.
different. So
Yes.
it's like we can't compare ourselves to others. We cannot, like, it's like, and I have that all the time. Clients are comparing their bodies or their health. I'm like, you're in a different season.
Yeah.
We need to
And
acknowledge what
social
you
media
do
doesn't help
know.
with that, but there
Yeah,
is
social media does not help with that. Uh-huh.
and there is that importance to like not compare, right? Don't, especially right now, like one of the things I like to say, and something that I've heard before, I didn't make this up, is like, don't compare your chapter 1 to somebody's chapter 20,
Mm.
right? Like
Yes.
both of us have been doing this for 11 years now. So where
Yes.
we are today is so different from 11 years ago and so different from even 3 years ago or five
Yeah.
years ago. You know what I mean? Like, and so there are different places that we've come to. And like for me, a lot of it has also been like when you talk about that quieting and stuff, that was a big part of my journey too. And one of the things I didn't even talk about is I had my own autoimmune issues. Um,
Oh, yeah.
since birth, I had digestive issues, I had menstrual irregularities. And so eventually, seeing the naturopathic doctor, I finally got diagnosed with Hashimoto's and PCOS. And so this is a big part of why I do the work that I do now within my practice of supporting couples with infertility, and then also like supporting women mostly, but also men. Like I just had a male client within my fertility clients, and he has hypothyroidism, and I'm like, it goes missed so often in men, because they just don't test it because it's not as common, but it's pretty common. Um,
Mm-hmm.
and so those are the things that like I had dealt with personally to get to like, and so when I actually worked with a naturopathic doctor, a lot of the work that honestly most of it what I did was physical. But a lot of it was like emotional, mental, where I started to practice more yoga. I started to meditate and started to understand what just like slowing down was. But it really wasn't until the last like few years, like it was 2020 when I started my practice in January 2020, and I decided I was going to do these abundance meditations and make it a challenge. And that was when I started getting way more consistent, right? In the last almost 5 years, I've been way more consistent with meditation. And even this past year, it went from I was doing it, 10 to 15 minutes, 3 to 4 times a week, to this year, now I'm doing it 30 to 60 minutes 6 to 7 days a week.
Mm-hmm.
Like
Mm-hmm.
it has really drastically
With
changed
a small child.
with the
So no
child. Yes.
excuses for
Yes.
anything.
Yeah. And that's the thing. Now I
Mhm.
realize that I actually don't have time not to meditate,
Yeah.
right? My son is almost 3. And I mean, yesterday we actually meditated together for 20 whole minutes together
Oh,
as
good
a
for
3-year-old, right? Like
him.
an almost
Oh, that's
3-year-old can sit there,
incredible.
you know?
That's
Um,
incredible.
yeah. I mean, well, I would say the first 10 minutes he was still eating, but still.
Oh.
But like he allowed for that, right? And just to be able to like stop and do that with him, teach him that he can start to regulate in this way too at this young of an age. It feels like such a beautiful like privilege to be able to do that.
Mm,
And it also feels like my responsibility, right?
mm.
Like it's like this is my responsibility. I don't have time not to meditate anymore. That's what I tell people. I'm like, I actually don't have time not to.
Yes.
Because when I do, everything is way less overwhelming. Everything feels just more at ease. Like I have
Yes.
more peace. Like everything is like, even whenever there is a stressor, I'm like, okay, let's see how we can move through this. Right. Like
Yep.
it's so much more like it's not like, oh my God, what am I gonna do? It's like, right, what is this? Or if I have
Yes.
to make a big decision, I'm like, okay, let me check. Let me just check with my
Mhm.
intuition. Let me check with my gut, with my heart. Well, what are
Mhm.
we thinking? All right, that's what we're gonna do. Right.
Yeah, totally. A big part for me in decision making was also recognizing that sometimes the truth is that the decision has not arrived yet.
Mm,
So just
yes.
allowing to be
Allowing.
in the space and be like, well, the truth inside myself is I don't know.
Yeah.
And so that's the truth, you
And just
know?
being present with that, right?
And
And
being
being
like, I
okay with
trust
that.
myself enough that once I do know the truth, I'll know and then
Mm,
I'll immediately take action. That's a big place that I work with a lot of my private clients on is they get so hard on themselves in between the times where they have not decided because obviously with leadership, so they'll be so good in leadership or business or whatever. And so they're making decisions quick, 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 quick. And that's how you become successful in business.
mhm,
And when it comes to your life, when it comes to you having inner peace, we actually need to learn how to sit in the indecision.
mhm,
It's such a beautiful space to be in and like allow for your own inner wisdom to kind of kick on or like consider that there's also more information to be gathered in the time of decision.
mhm.
That's what, have
Yeah.
find for myself and my clients and, and then when it comes, it's like an actual beautiful result versus in the past, I also had to deprogram myself out of quick, 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 quick. I would still produce results, but maybe I wasn't fully happy with the end result at the end, or, it
And
didn't,
you didn't
come
feel
to fruition.
fulfilled within it.
Yeah.
Yeah,
So it's like, it really pays to slow down and like feel into it until it's fully formed.
Yeah. Because there's
Um,
one thing to like look good on paper,
mhm,
right?
mhm.
Or on social media or
Yeah.
whatever. It's like you
Mhm.
like that's one thing, but like how are you like actually feeling? Right?
Yes.
That's the important thing. And that's like like one of the things that like for me that's been the biggest practice also is just like, okay, like I actually don't care at all how I look on paper or on social media. Like I
Mhm.
actually realized to the level of like, I'm like, I really don't care. It's about how I feel because this is
Yes.
my day to day, right? Like
Mhm.
I actually don't care what it looks like on the
Oh my
outside.
God.
Um,
Woo! Cut
which
from
is
the same
fun.
cloth. I just told a client of mine last week, we did a special, like extra long call for our group, and she was talking about, being attractive. And so with her weight and all this type of stuff. And I was like, thinking for myself, so they can learn from what I do. And sometimes you have to study yourself to be, but it's
Yeah.
like I really have a different and more expanded definition of attraction. Like it's not just physical, right? It's also like you're saying, it's not about just how other people see me. It's really the whole, do I feel attractive as a being because of how I'm being?
Mhm.
And just sometimes my clients, they, have relationship stuff, either they want to find their partner or whatever. And they're like, yes, but if I have this weight on, I won't be. I was like, yeah, so maybe, you'll land the hot date. But if you haven't worked on some of the inner stuff, so say you still have like a lot of drama or you have a lot of, whatever, like the guy's going to fall off quick,
Right.
because they're going to see that beauty is, just skin deep or whatever.
Right. Well, and I mean, I've seen so many beautiful women and so many toxic relationships.
Oh, yes.
You know,
Yes.
so it literally does not mean anything. And I've seen so many like women who like again, according to like the conventional, like maybe don't have this perfect body or whatever, and they're in beautiful, healthy relationships, right? That
Yes.
means absolutely nothing at the end of the day. And it's just like
Yep.
being able to like see that you're like, it actually doesn't matter. And there's starting to love, like, I mean, like I used to be like, if I was in a different yoga pose and like I had a little extra flub, I'd be like, oh no, you know,
Mhm.
like stressed out about it.
Mhm.
And now I like will sit with the flub and just be like, I love you.
Yes, I
I
know.
love all of
Literally, when I was in the car driving to my office today, I was like, I could feel it. And I was like, wow, do you remember back in the day when after a holiday, you'd feel this and you'd not be able to focus on anything else? But I was just like, yes, my post-holiday, like, whatever. And like, love it. Like, I have no qualms. But I was like,
love it.
I
Yeah,
remember when it was like
right.
all consuming,
And body
like you're
fat is
saying.
essential for hormone production. So going back into like the
Yeah.
fertility piece, like that's really important. For me, I was having irregular periods when I was
Mm.
at like 18% body fat
Yes.
percentage. And I was like, I literally had irregular periods, and it wasn't until I got to at least 21% that I started having regular periods, and it started
Yes, you
becoming
need
more
that to
normal.
have
And
that.
now I'm
Yes.
like, now I'm even higher, and it just, and I genuinely feel so much better in my body,
Mhm.
And so it's like these are essential because not just for your hormone production, but for your neurotransmitters, right? The serotonin, the dopamine, the GABA to reduce the stress. All of that is essential, and especially for
Yes.
women,
Women,
we're meant to have
yes.
more body fat.
Yes,
We aren't
exactly. Did
not
your
meant to look like these
travels Yes, did
fitness
your
people.
travels help with that? Because when I traveled to other countries and I saw that it was the cultural norm for women to have
A
extra
little,
body fat, like, and
yeah.
it was, like, loved and, like, appreciate I was just like it just was like it blew my brain out because American culture obviously is just like, we're still basing it off Twiggy back in whatever, 70s
Right.
as
Well,
we
and
came
now I
back.
think it's like shifted to like being like that toned body with like, like whatever
Right.
that is, like none of that is what we were meant to actually be. And if we think about
Mhm.
the who's the goddess of beauty,
Oh, yeah,
Aphrodite's?
yes, I think
Yes.
so.
Yeah. Like if you think about the image, like, you see her statues and stuff, she was voluptuous.
Yes,
She had, and it wasn't
exactly.
because now what I see is like curves like breasts and like booty are okay, but then you got to have like a small waist, like that's
Right.
like, and I'm like, no, 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 no. Like it's all of it, like
Everything.
all of it, And so
Yes.
it's just like, we think about that she's a goddess of beauty, right?
Right.
With
It gives
all
me the
of those
chills.
curves. And
Mhm.
so like that's like that's the energy that I'm in. Like that's the goddess of
Yes.
beauty. So like we are all in this beautiful life together. And
Yes.
yeah, so I'm just so grateful to be in this space where you can like not care as much, right? You can just
Yes,
like let
permission
go of
to
that.
actually not care,
Yeah.
and again with the, not comparing for everyone, it's like it literally starts like you pull it thread by thread as far as like it takes a can take a long time, but it's a like such a beautiful worthy cause to
Mhm.
actually work with someone who's going to support you with like, okay, this is what's my biggest concern today, attracting a mate at this weight. Okay, here's some mindset stuff for that. Here's some stuff you can do for the emotions and mentals on this, right? And then the
Mhm.
next week you're like, okay, like I'm eating way too many whatever at night. Okay, let's pull the thread on this and learn about that. Like it's just that's, and it just takes as long as it takes. But the opposite, like I really had an awareness for myself in my journey of like, because I got the super skinny body, same as you. I lost my period for a couple years.
Oh
And
wow.
but it was like I got the body, and even the coach who was running the program was like, "Yeah, but are you really planning on having kids anyway? Are you sure you want to have kids?" I'm like, "How could this be okay? Like that you're just gonna say amenorrhea is fine?"
Okay. I mean, don't even
Because
get
you're
me
saying the
started
French
on that.
formula, like your BMI was perfect for it was like, this is wild,
Not
like
okay
they're
with that.
literally teaching you how to have an eating disorder. And I got programmed into that for 3 years. And that's why I'm happy it happened because now I'm super equipped to help people who anorexic, bulimic, all the different things to be able to actually move through those things that most doctors are kind of afraid to touch, or they just immediately put the diagnosis on it and say, okay, we're going to watch you eat. That does not do it. You will
No.
not
And
get rid of anorexia or bulimia by being put in a clinic and watched.
right. And then being forced to
0% going to
eat
help
foods
you.
that honestly like make you feel worse too a lot of the time.
Ah,
Like I'm
and
just
so
like,
much shame and whatever. And
yeah,
it's
like
not touching
it's
it. But then I have
no.
clients who literally 4 weeks in the program, not binging, not purging. Even if they have an episode, it's like, I'm not scared of it. It's just like, okay, what are we going to learn from it? It's like purging it like is a way to help like a lot of anxiety come out. We know how it feels when we throw up. Like it's like,
Yeah.
and it's like emotion is coming out of the body. So it's like, wow, you found a brilliant way to release emotion. So number one, having a practitioner that's going to actually not be, so scared of that and to just be like,
Right.
oh, this can be okay. And
Mm,
then from that space of acceptance, love, no panic, no fear, it's just like, all right, so let's look at that. Okay, so you're feeling anxious about this, or okay, let's tweak that this time. And then they're not doing it again. Where in the past it'd be like, oh, well, I started, so now I'm going to keep going and keep going because I have a problem.
yeah.
No.
Wow.
So Anyway, just
Yeah.
amazing.
I
Okay,
love
so
that you talked about
then
the emotion, like a way of releasing the
I've
anxiety.
never heard
That's what it
anybody else
is.
talk about that
I have
before,
not
but
either,
it's
so I
literally
really
just been
appreciate that you.
my experience. I never got bulimic, but I just knew I could have. I had a friend who was, and I tried at one point in seventh grade. It didn't work out. But then when I was like, anytime that I just happened to be sick and threw up, I was like, I could see how this, you know,
Like a
can just
release.
help the
Yeah.
anxiety get out.
Yeah.
And
And that in
clients, they really
itself.
turn over because of that. It's like, oh, that does help me get my anxiety. So it's like, so let's just work on the anxiety in a different
Right. That makes
way.
sense. Yeah. I love that.
And it just, yeah, amazing.
Yeah.
Okay, so then, so you
Yes.
started in 2020, you made the abundance meditations and you started going out. So specifically, how do you help people today? What's it look like?
Yeah. So now, I mean, it's expanded so much, and I'm just so grateful. Like, of course, like, the more I grow, the more the practice grows, the
Exactly.
more our clients grow. Like, that's just how it works.
Yes.
And so now we're like, what we do, especially on the fertility side, right? So we work with both partners, and this is really important. And I haven't seen this really. I haven't seen many people, or actually anyone who does this. But I work with both partners, and so because it takes two, our program is called "It Takes Two," and that's because it takes two to make a baby, and not just make a baby, but raise a baby. And
Mm,
that part I think is really important to me because I'm not just here to help you get pregnant. Like, that's not even my goal. My goal is to help you get and stay pregnant, have a healthy pregnancy, healthy labor, healthy postpartum, and a healthy baby.
Yes.
Healthy baby, right? And I want
Yes.
to see, like, my big vision is that we have healthier generations. Like, this next generation is way healthier than we ever were, and they genuinely feel good in their bodies and their mind and their spirit. They feel good. That's what I want to see for this next generation and beyond.
Mm,
And when we start preconception, and there's so much research now that's come out, even if you're at a place where, like, I'm considering having kids, now's the time to start working on it, like, ever. Even if you're not, again, we talked about, like, you were just saying how your one provider was like, if you don't want to have kids, then it's okay. Like, no, it's actually not. It's actually not okay at all, because your fertility is your health. And so even if you don't want to have kids, start to address your hormone health, your gut health, all of these things, because it's so much more than just getting pregnant. Right.
mhm.
And that's what, like, as much as I will say, I do love when I get the "I'm pregnant" text. Those are like
Of
my
course.
favorites. Like, they
Yeah.
actually feel really good. And I love that so much. But that's not what it's about, right? Like, it's so much bigger than that. And so it's, yeah, so supporting you preconception is going to help epigenetically change the genes that you pass on to your offspring, to your child, to your future child, right? And so that is huge. So if you have an eating disorder, if you have been dealing with something like PCOS, hypothyroidism, whatever, any of these symptoms, digestive issues, IBS, those kinds of things, you start to address that at least 6 months pre-conception, ideally earlier. But a minimum of 6 months preconception, you're changing your DNA. You're
Literally
literally
changing your
changing that. So
DNA.
you're not
Yep.
passing the same issues that you dealt with
Yes.
to your kids. And that goes for not just physical things, but also mental,
Yep.
emotional,
Yes.
spiritual, energetic, right? All of the
Everything.
things we're passing on to our kids. So if we could pass on the healthiest version of ourselves, and of course we're going to continue to evolve and grow and things like that, and that's okay, right? But if we can pass that on to our children, that's essential. Like, even just me talking about earlier how I'm meditating with my son, right? Him being able to get these skills because I've cultivated these skills long before I had him, that makes a huge difference because now he's getting that support. Now I mean, literally, we say affirmations every night before we go to bed.
Mhm.
And the other day he was like, "Mama, can you say affirmations, please?" I'm like, like, it's getting like
So
like,
good.
because
Keep asking
it's like,
for
that's the
it.
thing about parenthood. You're always like, I don't know, is this working? Like,
Mhm.
but like, you just keep doing it anyway. And then, like, something like that happens. You're like, oh my God, I'm doing it. I'm doing a good job.
Oh,
I'm
I
doing
love
this
that you
right. Like,
got that. The fact that
it's
he's
getting to him.
asking.
Yeah.
Oh, that's
So
huge.
being able to have those skills, teaching them, like, healthy eating habits without putting any shame around food, right? Like just being like, okay, like this is what's nourishing for our body, like teaching them these things
Yes.
because you're already doing that, right?
Yes.
Teaching them that avoid, I mean, my son literally asks me all the time when we're at the grocery store. He's like, is this organic? I'm like,
Oh my
let me
goodness.
check.
Oh
You
my
know, so
gosh.
being able to like support your kids in that because you did the work preconception is essential. And then, so that's like my big why. This is why I do what I do
Mhm.
because I'm here for healthier generations. Creating
Yep.
generational health is to me the generational wealth, right? Like
Yep.
that is the wealth that I'm
We
trying
are
to pass.
so aligned in that as well. Like it's one thing, like when I can help my clients, but when I see them like sharing the tools with their children, and when like literally there was one client I have to share, she had a child, she had adopted her child through a family member and came from like addict, kind of past or whatever. So that stuff, right? Womb, it gets handed out. We see this all the time. Foster children, like they might have been given up immediately at birth and then they end up having addiction. Like this stuff gets passed on even when you're not a part of that child's life if it's not taken care of preconception, like you're saying. I even heard a podcast as a neurolinguistic programming trainer, which I am as well, and he was really sharing the science about how you really do pass on your thoughts, your feelings, your behaviors, like to through the womb.
Yeah.
Um, and a lot of the work that I do, like past life regression, even stuff like people will have memories come up of like being in the womb, or all of a sudden they'll remember the trauma that there was during birth or whatever. And it's like they clear those things, or someone told them like, oh, we didn't really want to have another kid. And then you came around, you know what I mean? So now they have this whole inadequacy thing. Like these things change who you are and everything that goes on in your life. But yeah, so going back to the story of the client. So this mom, she didn't know how to regulate her own emotions, right? So she comes to me, she has a weight issue. She also had diabetes, but she never really learned the coping mechanisms. So she would get overwhelmed a lot, lock herself in her room and like to handle her teenage daughter and all this kind of stuff. And so, how can you, if you don't know how to process your own emotions, your children will not be able to process, which is so awesome that you're meditating with your son like that. So he's going to be able to do it. And then after she was like 1 week away from graduation for my program, like 7 weeks in, her biological mother, didn't show up at her graduation. And that was, very upsetting for the daughter. And in the past, so it was her and her husband in the car, and her husband was saying to the daughter in the back who was disappointed, like, don't worry about it. She's not worth it. Keep going, blah, blah, blah. And she was like, no, it's important. Like she said, it's okay for you to feel really angry, upset, disappointed, hurt, confused. Like all of that is valid. She never would have said that to her kid before. And her daughter was able to like process through the emotions she had. And then she was able to get to what the dad was saying, like, you know what? I'm really grateful for you guys. Then, like, it's not a big deal that she didn't show up, but people cannot get to that space on their own. They will be constantly stuffing down if we don't learn how to support them through the emotions. So just like hearing stories like that of like that changed that little girl's life forever. Like she might not be an addict herself because her mom did our program and then was able to support them through hard emotional things as well. So I just care so much about that too.
Love
It's,
that.
yeah,
Yeah,
that's
that's
a generation we can
huge.
really make a difference for forever.
Mhm.
Is it? And
Yeah,
but it starts with you, whoever's listening.
starts
Like
with you.
if you are identifying as like, yeah, there's opportunities for me to get better at this, and my food stuff is an indicator of the fact that I'm probably not processing emotions we never were taught. This is kind of a new
Yeah,
thing.
it's not your fault, right? Like
No.
most of us did not have that level of upbringing. And so like it's not your fault. And now it is your responsibility to
Now that
get your
you are listening to these conversations, like it is your responsibility at this
Mhm.
point to take some action and get better at it. But it can be fun and gratifying. I like to make my stuff fun, even though we can deal with serious topics. It's like we learn
Absolutely.
best in a
Oh,
fun
play is
environment.
always involved. That's like
Yes.
a huge thing because play is always involved
Yes.
because that's what the child within us, right? That healing of the inner child, that's a lot of the stuff that we do as well, is like
Mhm.
healing your inner child because she or he, they're the ones that like are showing up whenever you're feeling those big feelings, right? They're the ones who
Yes.
come out because they didn't get that support. And so how do we support them so that, and that's what like, honestly, it's like the most beautiful thing. That's why I feel like this is going to sound a little controversial. I might get a little bit of hate, but like, I feel like if you're not feeling more and more healed, during motherhood, you're probably doing it wrong.
Wow, cool. I like that. That's
Like,
cool.
I genuinely feel that
Hmm.
because whenever I do the affirmations with my son, I'm like, yeah,
Mhm.
same. Like
That makes sense because you're
I am
doing things
safe.
to help him feel good and to do better. So you should also be feeling good and doing better.
Yeah, exactly.
That's
Like
cool.
I'm literally telling him like I am safe. I am loved. I am appreciated. And I'm like, I am loved. I'm like feeling that,
Yes.
like yes, I am safe. You know, and that little girl in me is like, okay, yeah, I am safe. Like she's hearing the same messages that I'm giving to my son, and so having that, like that's where I'm like, yeah, if motherhood is not just like the most healing experience, then I feel like you're honestly doing it wrong. So,
Yeah.
because
Yeah.
that's what it's here meant to be.
Yeah. Or you just don't have enough support,
Yeah.
to be
And that's
able to experience what you're talking about. Really
Yeah, and
agree.
that's where that like goes into, okay, like you're listening to this. Where can you go seek that support so that you can start to really take care of yourself, right? Like that's where, okay, where can you go to find someone,
Yes.
whoever you connect with, right? Feeling someone that you really genuinely connect with and feel supported with. You feel safe with them, right? Like
Yes.
that part is so important. That's why I always tell people, I'm like, I don't care if you work with me or you or anyone else, like whoever you feel safe
Yes.
with, because
Yes.
then when there's more healed people, more people are going to be healed,
Exactly.
right? Because
100%.
heal people, and that's
Exactly.
what it's about.
And that's the thing. It's like take whatever action you need to get that safe space and that support. It's just so, yeah, necessary. And we're all in that learning, growing path. And it's just identifying like what's the need and then getting that filled. And then, yep, you're going to keep passing that good energy down to the next person that needs it. So
Absolutely. Yeah. And so that's
really
like a
good
big
love.
part of our program is just like, there's technically 4 phases to the program. So like I said, it's called It Takes Two, and there's 4 phases. The first phase, we call it the detective phase, and that's like, where we're like, I would say we're like pulling out our detective glasses, like the magnifying glass, really figuring out what's been going on, why you've been feeling a certain way, why you haven't been able to get pregnant yet, what's been going on, instead of just like forcing you to get pregnant by pumping you full of chemicals, which unfortunately is like what I see far too often.
No.
But so that's what we're understanding is the why. And then from there, we're really determining, from there, we move to phase two, which is in naturopathic medicine, we call it removing the obstacles to cure. So what's getting in the way of your healing in your mind, body, and spirit? And
Yes.
so, of course, the body, right? That's the nutrition, the toxin exposure, the movement practices, all of that. And then there's like, of course, then the mind and the spirit, the energetic blocks, the mental blocks, the mental health things that you have going on, all of those things, what's getting in the way, right?
Mm.
And then from there we move into the phase three. So now we've removed all the obstacles to cure. Now we can really focus on the nourishing, healing. And then we move into the last phase, which is building resilience. And this is where really anything comes your way. You have a little bit of the holiday cookies or whatever, and you feel fine. You feel fine. You don't, you feel good in mind, body, and spirit. You know that you can handle it, right? I had 3 sugar cookies yesterday, and I genuinely still feel great today,
Yes.
and so
Yes.
like,
Mm.
so that is the point. That's the goal, is to build that resilience. And now, because you are more resilient, you should be able to ideally be able to get and then stay pregnant, have a healthy pregnancy, healthy
Yes.
labor, healthy postpartum, and of course, a healthy baby.
Oh my
Right?
gosh.
All of those things are really important. And so we've had clients who've been through multiple rounds of IVF or IUI. Like I have one client that I'm thinking of in particular, she actually went through 5 failed IVF cycles, and 3 miscarriages, all through IVF. She got pregnant. So this is why I'm like, it's not just about getting pregnant, right? She got
Right.
pregnant 3 times through IVF and
Yep.
miscarried all around 8 weeks. And and then we started working together within the questionnaires themselves, like that detective phase. I was like, oh, where she's working has a lot of environmental toxins. We need to do some toxin testing. We did toxin testing. We worked on her mental, emotional, spiritual health, all of those things. And within 5 months, she got pregnant. 9 months later, she had her beautiful
Oh
baby.
my God.
Right? Huge.
Amazing.
So this
Yeah.
is why I'm so passionate about what we do. It's
Yes.
like, wow. And she spent like almost $100,000
I
on
know.
all of that. Like and I'm like, and if we would have just addressed the root cause from the
I
beginning,
know.
$100,000 in 4 years
Can you believe
is
it?
going through that,
Oh my God. I
right? Like,
know. how
So if you're in that
significant.
space, like don't waste time
That's
and energy, like and
do the
money.
deeper dive
Yeah,
first, at
before,
least.
yeah. Because I
Yes.
mean, we do have some couples who end up going through IVF. We have about a 75% success rate
Mhm.
of healthy babies. And I always like to very much specify that.
Yeah.
Not just getting pregnant, healthy babies. We have a
Yes.
75% success rate and naturally helping people have healthy babies. But about 25% of the time, we do have some people go through IVF. And it's been, we have, I think, one or two couples right now that are going through it. But overall, everyone has like within the first cycle has been successful with their IVF.
Mm,
So of that
wow.
25%. So that's why if we address the deeper stuff first and then
Yes.
we use the
Yes.
pharmaceuticals, then there's a higher likelihood that everything's just going to be more successful.
Yeah. And I'm just really present to like how much just I'm sure just them having that safe container with you and your practice like really also can make such a difference because people the lack of safety. Oh my gosh. Do you feel like that too? Like,
Absolutely. And just feeling
yes,
supported. I mean, I've
right?
had some
I
couples that
know.
like struggled for years and then like literally just as soon as they book, like they get pregnant because
Yes. Oh my
they like,
gosh. Yes. 100%. I see it
and
with
I'm
my
just
clients
like,
as well.
oh,
Like all of a sudden everything clicks as soon as they sign up. Yeah.
yeah.
It's
It's
like
like just
that's
like
how the
because they
universe works
finally
though.
feel
That
support.
goes along with what we were saying in the beginning of like it's aligning and being like, this feels true to me, taking action on it. And it's like it's already done when you're just aligning and then just kind of trusting the process as you go from there. So
Exactly. Yeah, that's
incredible.
been huge. And that was like something that like all of them who end up getting pregnant, like almost right after they book, they're like, I just felt like was finally supported. And then
Yeah.
now
Yeah.
they've been trying for years. And now we kind of just transition, the
Right.
program. And we're
Healthy
like, okay,
baby.
obviously now we're
You
focused on
stay
the
pregnant. Yep.
pregnancy. And
Yep.
then we still support the men because I do think that's like, as much as women's health is completely a mess in our healthcare system.
Yeah.
Men's health is just completely dismissed. And so
Mhm.
that is something that we're like, okay, well, we're still going to support the men, and it's been really cool to see like men who like one couple I'm thinking of in particular, like she got pregnant like almost immediately after. Like literally it was like she ovulated after they like booked, and then like they were pregnant. It's like that's
Nice.
funny. Um,
Hmm.
but I started working with her husband regardless, and he was like, just like literally the other day, I met with her and she was like, he's so grateful. He's like, I had no idea I could feel this good. I thought I felt fine, but like, oh my gosh, I have so much more energy. I'm sleeping better. I feel so good. I feel like I'm ready to like take on the world. And I was like, yes, that's what we want, right? Like, and so
Yes.
that's where we're like supporting because a lot of men and women, we've all just like accepted some baseline level of suffering, you know?
Ah, yes.
And I'm like,
Yes.
we don't need to accept that. That's actually
No, yeah, we
not
can
what we
feel
need.
really good. I know. Oh my gosh, how lucky they are to have you on their side. And then just on that note with the men, so if they don't get immediately pregnant after signing up, I also heard like the men's sperm and their diet and right. I
Yes.
think I knew someone who even the men's sperm got tested, the same thing. They went through IVF for years and all this stuff, unsuccessful. And the sperm came back fine, but then the wife just had like an intuition. I was just like, can you just like stop drinking beer? And this person drank beer a bunch and then, their last try with, so do you see stuff like that with
Yeah,
the men's
absolutely.
health
I mean,
and
that's
yeah.
that's a huge part of it, right? Sperm health
Mhm.
matters.
Yeah,
And
of course.
poor sperm quality can not only increase risk of infertility, but also increase risk of miscarriages in women, complications during pregnancy,
Wow.
and genetic abnormalities in the child once they are born. And so that's why addressing the sperm health is essential. And now what is considered normal in terms of a sperm analysis would have been considered infertile just 20 years ago. Okay. Just 20
Wow.
years ago. Yeah. And so that's why
Wow.
we're looking at
We're
labs
just accepting worsening health.
exactly. We're just accepting it and we're just changing the ranges. You've been in the conventional system, so you know how sometimes they'll just change the range and you're like, for what?
Yeah,
Like
right. Yeah, we
what
don't
has changed?
question it. It's just changing of the range. Yeah, probably so that people have to go and do IVF and we can make more money faster.
Right. I've literally
Oh,
had couples who have come to me because their doctor was like, oh, like his sperm quality is not great, but like we'll just put you through IVF. All we need is one good sperm. It's like,
yeah. Are you
What?
kidding me? Yeah,
Like,
IVF.
yeah, no, it drives me crazy because now you're
Ugh.
going to put this woman through all of those invasive
Yes.
procedures,
Oh
her
God.
mental, emotional health, dealing with
Talk
all
about a lack of
her physical
safety.
health. Yeah, right. She goes through all of that because his sperm is
Financial
not great.
component. Yeah, because of that. Oh my
Yeah.
goodness. Yeah,
And then now we're also not addressing his health either, right?
I
We're
know.
not addressing because his sperm health is also associated with his testosterone, his hormone health, his cardiovascular health, his brain health, his mental
Yeah.
health. But whatever, now he'll suffer and then
Yeah.
she'll
And
suffer
then
through this
die
whole
young and
experience.
then leave you as a single parent. And because we just,
What? It
I
just drives me
know.
crazy.
I know.
And I've had couples that have come to me that they were like, we didn't want to do that because we felt like there should be something else. And I'm like, I'm so proud of you for recognizing
Yes, I
that,
know. And that goes back to that following that intuition, and that truth within yourself. Because again, I really believe that like people will do, what they're going to do, but let's be educated, which is why we're here. This is why we're having this conversation. Cause it's like, okay, well, let me actually look because something feels off to me.
Right.
And if going the IVF route feels like it's absolutely, and you've done your research, okay, nothing, do what's right. And like you said, you advise 25% of your clients. Sometimes it's necessary,
Mhm.
but just do your homework, really
Absolutely.
like be present to the situation. And
Yeah.
yeah, so anyone listening, please share this episode if you know anyone who's struggling getting pregnant. It sounds like you haven't. Do you work virtually with people or just only in?
Mhm.
Okay,
Yeah,
great.
all virtual, seeing
Amazing.
people all over the world. Just
Amazing.
have a few clients, yeah, in
Amazing.
like
How
England,
can people
India.
find you? You obviously have your podcast too, but yes, how can people
Yes.
find you?
Yes. So you can find me. So Instagram is the place where I'm most active.
Great.
But I am on everything like TikTok,
Hmm.
Facebook, Twitter, all of those, all of the same handle, Holistic Hanisha. I will say Instagram, like I said, isn't where I'm most active. So if you send me a message there, I'll always respond. Everywhere else, I might not, to be
Yeah.
completely honest.
Yeah.
But you can find me there or on our website. And yeah, so I do have my podcast. I'm revamping it soon. And so we're actually rebranding. So it's going to be Healing with Hanisha. Um,
Mm,
instead of Mahan Health. Mahan Health is our practice name,
mm,
and that is very near and dear to me. But the way I'm switching the podcast is to be a little bit more about honestly my own healing journey, a little bit
great.
more personal. And so that's why I'm rebranding the podcast. But Mahan Health, that's like Mahan in Sanskrit translates to great or the absolute best. And so um, I think that's the only thing that actually makes sense to me now is when we actually experience the absolute best health. And so so that we can
Live the
be
absolute best life.
live the absolute best lives, literally live the life that we desire,
Yeah.
and then support our kids in being able to do the same. So
Yes. Thank you so much for being
thank
here. I'm really looking
you.
forward to being on your podcast, and I
Yes.
could talk to you all day long.
You know,
So anyone listening, definitely check her out, Dr. Hanisha Patel. So like Instagram could be the place to go for her. And definitely check out her podcast as well. So thank you all so much for being here. Also, if you are ready to get help with your food, body, weight journey, work on the HEAL method, hpwl.co to be able to book that quick call. Thanks so much, and we'll see you for the next episode.
thank you.
If you are serious about taking action on your struggle with food, body, and weight, then this is for you. Go ahead and text the word hypnosis to 855-BE-ALIVE. That's 855-232-5483. Immediately after texting that number, you will get access to our free training that will tell you why you can't figure the food, body, and weight thing out, why you can't keep weight off even after you've been successful in the past, and how to actually overcome it, including a mini hypnosis session at the end. Don't miss out. Text the word hypnosis to 855-BE-ALIVE. That's 855-232-5483.